Hello and welcome to another episode of Brunch with me, Ellen. On today's show, we are talking about IVF and surrogacy. Now, these are options to helping couples with infertility have children. Now, infertility is a subject that is very sensitive for most people and is shrouded in secrecy. Nobody wants to talk about it. But I sat down with Dr. Mhlanga from IVF Zimbabwe, who just delved deeper into the subject and tore the veil of this options of having children, which is IVF and surrogacy. So if you know somebody who is going through infertility or subfertility, struggling really to have children of their own, this is the show for them. Do share this link, and if you're going through it, do stay tuned. Let's just dive right into it. Could you share a brief background of IVF Zimbabwe and what you guys do?
So IVF Zimbabwe is a fertility clinic. It is 2 years old, and it's a clinic that essentially helps couples that have failed to have a child naturally. So when they come to see us, we then offer them intervention that assists them to hold a baby.
What was the inspiration behind starting this particular clinic?
The inspiration was essentially from the burden of fertility in our country, and to try to help Zimbabweans to access IVF locally. Having seen the problems with patients going outside Zimbabwe, South Africa, India, we decided let's try to set it up in Zimbabwe and offer the service locally. We are happy that we have successfully done that, and we have witnessed 44 babies that were delivered, and we assisted almost 42 couples, two twins in those babies.
Oh, congratulations, that's amazing.
Yeah.
And at what point in a couple or a woman's life should they start considering coming to see a fertility specialist?
So for somebody who is younger than 35 years, with a regular cycle, we actually want them to come see us after 1 year of regular unprotected intercourse. But for somebody who is older than 35, we ask them to come see us in 6 months' time. Or somebody who has had some fertility problem before, or who doubts her fertility. For example, a woman with irregular periods, a woman who has had ectopic pregnancies, pelvic inflammatory disease, or somebody in their second marriage and the first marriage having broken down due to fertility. We ask them to come see us a little bit earlier than 1 year.
All right, doctor, take us through the process. From the moment they see you, consultation, just take us through that whole process. What can a couple expect?
Okay, so the first thing that we do is when we see couples, we take a history, we examine them, and we send them for tests. When we do the investigations, we want to see where the probably causes. And for somebody, for example, a woman with blocked tubes, we then say she needs to have IVF right away. Once we see that this woman is ready for IVF, the process is easy. We prepare medication for her, what we call a stimulation protocol. This is a guide on how she's going to take medication. The medication that she takes are essentially injections that are timed to her cycle. And we give injections to stop ovulation because we want to collect the eggs. We give a medication to produce a lot of eggs because we want to have so many embryos and to be able to choose the best embryo from those embryos. So what we then do, we give the medication, we follow them up with a scan to see if they are ready. Once they are ready for harvesting, we then give them an injection that matures their eggs, and we take them to theater. As we take them to theater, we don't really intubate them, we just give them enough medication to sedate them and make them not feel any pain. Then we harvest. We don't cut them open. Our way of harvesting is we do it transvaginally, using a transvaginal scan and a needle. So essentially the scan locates the follicles which contains the egg, and with a needle we puncture the follicle and aspirate, and that goes into the test tube. And that test tube then contains the egg, and that is passed to the embryologist, who will then look for the egg in the fluid in the test tube. And after identifying the egg, you then mix with a processed semen, and fertilization actually occurs outside the body, hence in vitro fertilization.
Okay.
For us, in vitro fertilization essentially means that process of fertilization that used to occur in the fallopian tube is now happening outside the body. The embryo then develops in our lab, in our incubators, and we look at it every day. Depending on the number, we normally transfer on day 5. After selecting the best embryo, we put back a maximum of 2 embryos, and the rest of the other good embryos we actually freeze.
Are there any risks associated with in vitro fertilization?
Let me start off by saying there are several risks that are mentioned, and we are happy that a patient that went through our IVF through our clinic, we have not had any major complication. However, the reported risk that we've had, 2 patients that have delivered twins, and also a case of ovarian hyperstimulation syndrome. This is whereby a woman produces a lot of eggs, and it also comes in with some complications, for example, shortness of breath. But to take you through the complications that are talked of in terms of IVF, so the commonest actually is multiple pregnancy, which is then followed by ovarian hyperstimulation syndrome. The other risk factors, actually there's a high risk of ectopic pregnancies, and since like I've explained, when we harvest, a nigdo has to go through the pelvis. So there are structures that are within the pelvis that can be injured. For example, the bladder, the intestines, and the blood vessels. And also after this procedure, there might be infection. But I also want to emphasize that we are talking of these complications. We have not encountered them. And we essentially think that IVF is a safe procedure that should be pursued if people have failed to conceive naturally.
Every time I've read about IVF, it's something that seems like it's out of reach for many people. What are the financial costs that go into this process?
Before we talk about the cost of IVF, when you look at a couple coming to see us, for example, a good example is patients with a polycystic ovarian disease, which is essentially a disease whereby self-fertility is caused by one woman not ovulating. In that case, we tend to offer them ovulation induction, which is a very cheap option. So you are looking at least at less than $20 US dollars in terms of cost. That is only for the medication that you use, the clomid, letrozole, or the gonadotropins. You also look at other intervention. For example, in a patient with unexplained self-fertility, we offer them intrauterine insemination. This is whereby we give a woman some ovulation induction drugs, and as they ovulate, we process the husband's semen, and we leave it in utero, closer to the egg, and it works for in some cases of unexplained self-fertility, and it's a cheap option. It costs about 410. And then when you look at IVF, for example, for women with blocked tubes, endometriosis, low sperm count, you are looking at about $3,000 US dollars.
This is $3,000 per cycle, or until somebody has their baby?
Unfortunately, it's $3,000 US dollars per cycle. One of the reasons why it's expensive is you look at the cost, the resources that a patient uses. The medication that they're going to use, they cost almost $1,000 US dollars. The media that we use to culture the embryos, the needles, the petri dish, the embryo transfer catheters, all in terms of resources, you're looking at about 2,500 without including labor. So for us, it's expensive, but at the same time, what we have done in terms of our pricing, we've looked for the cheapest nearby fertility center, and we've made our prices the same as that fertility center. What it actually means is it's going to be cheaper for them to have it done in Zimbabwe than traveling outside, factoring in the inconvenience, factoring in the hospital, the hotel stay, and you see, with us there's no language barrier. You come, we speak with you in our local language.
What if IVF fails? Are there any other options that women can explore?
The first thing is IVF is not 100%. So that cases whereby the first time or first cycle fails, it's going to depend on what stage. Normally, sometimes we actually encourage you to go for another. But in the case that we feel that IVF is not really working, there are options, for example, adoption and also surrogacy. By definition, usually, surrogacy is when a woman carries a pregnancy with the intention of giving up the baby to the commissioning parents. And this baby is not genetically linked to the surrogate mother.
Are there any successful surrogacy cases that you've had within the clinic?
Our clinic has registered 2 live births from surrogacy. So it's an option that is available in our country. And for one of the patients who went the surrogacy way, she had 3 recurrent miscarriages, and after the 3rd one, she couldn't conceive. So she decided to go the IVF way. And we are happy that she's now a mother.
Okay. Well, congratulations to her. We're going to take a short break now. We'll come back after this. Welcome back. You're still watching Brunch with me, Ellen. On today's show, we're talking about IVF and surrogacy as viable options to starting a family. We spoke to Dr. Mhlanga, who gave us his views of IVF and how their organization is helping couples do that. Now we're speaking about surrogacy. Doctor, tell us, what is the whole process of surrogacy? How does a couple go through this?
All right. So when a couple has decided to go the surrogacy way, the first thing they have to do is to make a choice on whether to have us provide a surrogate for them or to bring a surrogate. We normally recommend that they bring their own surrogate. It makes everything easier. A surrogate can be a sister, can be a friend, can be a cousin, anyone with a healthy womb. So when a surrogate mother comes in, we essentially screen them for infection, anything that is contagious that can be transmitted to the baby. We also factor in age of the surrogate. We need somebody who is between 21 to 35 years. It can be somebody up to 40 years, but our preference is somebody younger, and preferably somebody who has had a child who has been proven to be fertile.
What are some of the financial aspects? I don't think anybody can go through this without, well, unless they're kind-hearted and they just want to go through this and help somebody have a child. But are there any legal documents that they sign?
So for us, we provide the couple with a contract. And normally for the financial aspect, we allow the couple and the surrogate to have discussions, and we overlook the discussions so that at the end of the day, the surrogate at least gets a token of appreciation. For us, it's not business for the surrogate, but we want to appreciate their good heart.
All right, thank you, Doctor. Thank you so much for taking time out of your day to be with us here on Brunch with Ellen and sharing insightful information about IVF as well as surrogacy here in Zimbabwe. Thank you.
Thank you.
Right, well, that's the show for us today. We're talking about IVF and surrogacy as viable options to starting or expanding families. You don't have to go it alone. IVF Zimbabwe is here for you. For more on their details, we'll have them scrolling here at the bottom of our screen. We'd also like to thank the venue for giving us this fabulous location to shoot our show. And from me and the crew behind the scenes, it's bye for now.